Universal healthcare is a long contested political point in the United States. And in 2020, it seems that its future is as uncertain as ever. Donald Trump and Joe Biden's approaches to healthcare are very different. So let's dive into these two candidates' proposals and how they could affect you. In 2010, the Obama administration passed the Affordable Care Act. You might also know this as the ACA or Obamacare, and it was one of the largest healthcare reforms in modern history in the United States. The Affordable Care Act greatly expanded healthcare to citizens by providing subsidies and requiring universal enrollment when it was first implemented. To put it into perspective, in 2010, 22.3% of Americans were uninsured. In 2016, just 2 years after states implemented the ACA and expanded Medicaid, that number dropped to 12.4%. President Donald Trump has been highly critical of the Affordable Care Act even before he became president. A lot of his 2016 presidential election campaign was based off of him promising to repeal the Affordable Care Act and replace it with something better. However, 4 years later, he still has not come out with a replacement plan. However, he has done numerous things to try and repeal the Affordable Care Act or weaken it piece by piece. Under Trump, key parts of the law have been undercut. The Trump administration has cut back on spending for in-person enrollment assistance centers, and it ended cost-sharing subsidies. These in-person enrollment assistance centers were super important for helping people get access to the resources they needed to navigate the marketplace and to enroll in coverage. Cost-sharing subsidies were also important because they helped insurers pay for out-of-pocket costs for low-income Americans who couldn't afford it. Together, these two actions by President Trump have resulted in lower enrollment numbers and raised premiums, according to the Center on Budget and Policy Priorities. A separate analysis from the Kaiser Family Foundation actually found that Silver Plan premiums increased from 7% to 38% as a result of ending cost-sharing subsidies. President Trump passed an executive order in September that protected people with pre-existing conditions from being denied health care coverage. Interestingly enough, though, this was already something that was in the Affordable Care Act. So a lot of critics and analysts have said that Trump is putting himself in a position to simply rebrand the Affordable Care Act as something else to make it potentially more appealing to more people within the Republican Party. Also, a lot of policy analysts are saying that this executive order is largely symbolic and by itself, without additional legislation for a replacement to the ACA, this executive order does absolutely nothing to protect people. Joe Biden was part of the Obama administration when the Affordable Care Act originally passed. He has come out with a plan to enhance it, and that means lowering costs and increasing coverage for Americans. Joe Biden's healthcare plan would create a new public health insurance option that would work similarly to Medicare. All Americans would have access to this option, whether they're self-employed or even if they are offered insurance through their employers. Anyone will be able to turn to this public option and choose coverage that best suits them. Joe Biden's healthcare plan would also increase tax credits and remove the 400% income cap on tax credit eligibility to help lower insurance premiums. Joe Biden will also lower the limit of how much cost of coverage can be regarding income. Currently, it can be as much as 9.86% of someone's income. He wants to lower it to 8.5%. Joe Biden's healthcare plan would also offer coverage to Americans who are eligible for expanded Medicaid, but live in states that refused the Medicaid expansion. This would result in an estimated 4.9 million Americans getting access to health insurance. An analysis by the Kaiser Family Foundation finds Biden's plans would significantly lower the cost of nearly all current enrollees and prospective enrollees who might currently be priced out of the market. The analysis includes an example of a 40-year-old making $50,000 per year, saving 32% on his gold plan premiums each month. One important thing to consider about Biden's plan, however, is that it will increase federal spending. The current federal deficit sits at $3 trillion, an all-time high, and adding more costs like this could become a major source of contention among lawmakers in Washington. Overall, Joe Biden and Donald Trump have two very different visions of healthcare in America and how they want to achieve coverage for Americans. Joe Biden has an extensive plan to enhance the Affordable Care Act, and his major goals are to increase coverage and lower premiums. Donald Trump has long been saying that he wants to repeal the Affordable Care Act and replace it with something new. However, we have yet to see any form of a replacement plan from his administration. Notably, the Affordable Care Act will face a Supreme Court hearing just 1 week after the election. So the future of the ACA is as uncertain as ever, and we'll have to follow along closely to see what happens next.